topic that we decided to investigate is the application of nanoparticles in medical imaging. I'm Vivek, and I will be providing some background information and an introduction to the technology. Johnny will provide some more detail on the advantages and disadvantages of nanoparticles in imaging, and George will finish with some current and future applications of the technology. Firstly, it's quite interesting to note that the use of nanoparticles dates back to the 9th century, where they were used to provide a glittering effect on clay pots, but they were actually unaware of why this effect occurred. Michael Faraday first observed the optical properties of nanoparticles in 1857. They're described as any particle from the periodic table between 1 and 100 nanometers, but they're most commonly metallic, for example copper nanoparticles. They are applied in medical imaging as injectable contrast agents, and their luminescent properties allow them to be detected by up to 6 different imaging modalities. So why is it important? Well, it's well documented that different imaging modalities are effective for detecting distinct ailments and different body tissues. For example, bone is well imaged by X-ray, CT can image soft tissue and vessels quite effectively, and blood flow is well imaged by ultrasound. The importance of nanoparticles is that they can combine all these different imaging modalities into one technique by using the one contrast agent. This provides the possibility of individuals having a single scan from one machine rather than multiple scans from different machines. And given that radiation dosage is problematic in some imaging techniques, having one scan for a patient will reduce their radiation exposure. Nanoparticles have given rise to the ability to conduct both in vitro and in vivo medical imaging. Due to the small size of nanoparticles, they have the ability to enter cells and, given the appropriate imaging modality, can provide real-time imaging of cells and cellular processes. In vivo cellular imaging is a novel medical imaging idea, and nanoparticles provide scope for its advancements. So nanoparticles are important to medical imaging as it can reduce the amount of scans required for a patient, and it allows for cellular imaging, which will provide us with a new perspective in diagnostic imaging. So how are nanoparticles made? Well, they can be made in the top-down method or the bottom-up method, meaning they can be formed by the disintegration of bulk materials or through controlled chemical reactions. The bottom-up method is more common in biological cases as the final product is more pure. One method involves the conversion of gases into small liquid droplets, followed by condensation reactions and growth. And another method involves the automatic formation, where the atoms and molecules bind with each other and build up into nanoparticles in a strictly controlled liquid medium. I'll now pass it on to Johnny.
Thank you, Vivek. When assessing nanoparticles, there are certain factors that we need to take into account. Their toxicity level, how harmful can they be to the human body, how to synthesize the nanoparticle, their effectiveness in providing high-quality medical images, and their availability of resources. In general, using nanoparticles as a source for medical imaging has its advantages and disadvantages. The advantages are nanoparticles have the ability to enter cells, allowing for real-time imaging of processes occurring within the body, such as cellular process. They also have the ability to be absorbed in the blood, which allows detailed imaging of the heart, liver, and blood cells. Some nanoparticles have high luminescence and photostability to provide high-quality images, and they are significantly less harmful than using nuclear medicine imaging techniques. However, their extremely small size may not be detectable within the human body for the immune system to be triggered. This can potentially allow the particle to bond to the DNA and cause structural damage. Also, because the use of nanoparticles in medical imaging was recently discovered, there may not be enough clear evidence of their physical and chemical properties to provide any concrete knowledge of their toxicity and other hazardous factors. There are many types of nanoparticles that can be used for medical imaging purposes. Some current ones are gold nanoparticles for X-ray and CT, quantum dots for optical imaging, and iron oxide nanoparticles for MRI. Other nanoparticles that are emerging in the medical imaging and possibly will be used in the near future are polyelectrolyte complex nanoparticles, calcium phosphate nanoparticles, and perfluorocarbon nanoparticles. But I will only be talking about the current ones. Gold nanoparticles are emerging as a versatile tool in imaging because of their relatively low toxicity and high X-ray absorption properties. They are low costing and have a broad availability, which makes them really efficient for medical usage. They can also be synthesized conveniently in aqueous or organic solvents with a high degree of precision and accuracy. However, they are not as stable, so they require a stabilizing agent to physically absorb or chemically bound to the surface of the nanoparticle. In a recent study, Hainfield demonstrated the use of gold nanoparticles as a contrasting agent for X-rays and CT to detect tumors in mice. One thing that Henfield discovered was that the gold nanoparticles were not detectable in the blood after 24 hours. This can potentially cause the nanoparticle to bound with DNA and cause structural damage. Quantum dots are fluorescent semiconductors that have unique optical and electrical properties. This makes them inorganic nanoparticles. However, they are coated with an organic coating which makes them biocompatible with the human body. These properties allow them to have certain characteristics that can be more beneficial compared to organic dyes and fluorescent proteins. Quantum dots possess a much greater brightness than most dyes. They have a relatively longer fluorescence lifetime and lower photo bleaching to a point where it can become negligible. But because they are an inorganic substance, the main toxicity risk is the exposure of the inorganic core by deterioration of the organic layer. And since the core is made from a large variety of inorganic metal compounds, the influence of the toxicity level depends on the compound used and their unique chemical properties. Iron oxide nanoparticles are similar to quantum dots. They have an inorganic core that require an organic coating to make them biocompatible. They have a strong magnetic field which makes them extremely suitable for MRI. They show acceptable biocompatibility at low concentration and high magnetic saturation. But because they are similar to quantum dots and have similar characteristics, they will also have the same toxicity risk as quantum dots. And now I'll be passing on to George.
Many metallic nanoparticles possess immense potential as X-ray and magnetic resonance contrast agents, and have a wide range of optical and medical diagnostic device applications. This is owing to their high attenuation, biocompatibility, and relatively low toxicity over a short period of interaction. MRI is based on the behavior, alignment, and interaction of protons in the presence of an applied magnetic field. Protons in the tissue are excited, and contrast agents are used to alter longitudinal or transverse relaxation times, which can be monitored by MRI to produce image data. Magnetic nanoparticles such as that of iron oxide between the sizes of 2 and 20 nanometers display superparamagnetism, a form of magnetism that appears in small ferromagnetic particles. These particles can produce intense magnetic fields that leave no magnetic memory on the nanoparticle or surrounding tissue. This process has been utilized as a means of magnetic sensing probes for in vitro diagnostics. Copper nanoparticles, whilst very similar to iron oxide and many other metallic nanoparticles, have a high thermal stability, making it the most ideal medium for thermographic imaging and transmission electron microscopy. In thermographic imaging, this is utilized in the detection of radiation via infrared imaging, whilst transmission electron microscopy will detect the cellular interactions within each specimen. Gold nanoparticles are X-ray contrast agents of choice due to exhibiting a high X-ray attenuation. The high absorption coefficient and physical density of gold nanoparticles, coupled with its ease of tunability, enhanced radiation emission, high biocompatibility have made a significant demand on synthesis and medical application. The active targeting of specific tissues via gold nanoparticles enable imaging by computed tomography as well as X-ray imaging. Quantum dots are fluorescent semiconductors that have unique optical and electrical properties. The yields of quantum dots have a much greater brightness than any other current fluorescent dye. Quantum dots show a broad range of absorption characteristics with a continuous tunable emission and relatively long fluorescence lifetime. These properties make quantum dots advantageous for medical imaging applications such as cell labeling and cellular trafficking. Photostability of quantum dots allow image data from many consecutive focal planes that can be reconstructed into a high-resolution 3D image. This assists greatly in medical fluorescent imaging due to the size-dependent fluorescence emission, or fluorophores. Nanoparticle technology is developing rapidly. Over the next decade, we will see nanoparticles become economically sustainable in synthesis, highly specific with little to no toxicity, intensify image attenuation, intensify fluorescent emission, and perform real-time imaging of patients, as well as to become reconstituted and collected safely. As time goes on, the use of nanoparticles will be able to reduce the number of scans a patient will need in their lifetime to ultimately have one scan comprised of many imaging modalities. As a brief summary of what we have learned today about nanoparticles, we can understand that nanoparticles are an imaging technique of the future, with the ability to streamline a range of modalities, sharpen image data, and perform real-time cellular trafficking. However, areas of further study are required to reduce toxicity levels, sharpen diagnostic imaging, and improve data relay, as well as to reduce potential patient radiation for future diagnostic imaging.